Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Basal joint arthritis. Introduction.
Basal joint arthritis is a common condition. It causes pain and discomfort in the hand and affects its usage. Basal joint arthritis is more common in female patients. Doctors may recommend joint replacement for people suffering from basal joint arthritis.
If your doctor recommends surgical treatment for your condition, the decision whether or not to have surgery is yours. This patient education module will help you understand the benefits and risks of this surgery.
Anatomy of the hand. The hand consists of many bones. The finger bones are called phalanges. The thumb has only 2 finger bones, while the rest of the fingers have 3 phalanges. The bones are separated by special hinges called joints. These joints contain fluid that keeps them lubricated, allowing for smooth motion. The bones that link the wrist to the fingers are called the metacarpal bones. The joint that separates the wrist bone from the metacarpal bone of the thumb is called the basal joint. Symptoms and their causes. The basal joint, the joint that connects the metacarpal bone of the thumb to the wrist bones, is sometimes affected by arthritis or inflammation. This causes severe pain and weakness of the hand. Previous fractures or repetitive motion aggravate the condition.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments.
Avoiding repetitive motion may allow the symptoms to improve.
You can rub creams containing capsaicin or other pain reducers over the joint.
Physical therapy may also help. Oral anti-inflammatory medication may decrease the pain and the inflammation. Injection of steroids in the joint may also help. When all else fails, an operation may help. Surgical treatment.
Different surgical options exist to treat basal joint arthritis. This program focuses on joint replacement.
The operation is done through a skin incision under local, regional, or general anesthesia. First, the surgical procedure aims at removing the whole joint or just a section of it. The joint is then replaced with a piece of tendon. In rare cases, a synthetic implant may be used to replace the joint. Your doctor will explain to you the procedures he or she recommends.
This surgery is usually done as an outpatient operation, meaning the patient goes home the same day of the operation.
Risks and complications.
This operation is very safe with excellent results. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early.
The risks and complications include those related to anesthesia and those related to any type of surgery.
Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt.
Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs.
Some of the risks are seen in any type of surgery. These include 1. Infection deep in the hand or at the skin level. 2. Bleeding.
3. Skin scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are also very rare. However, it is important to know about them.
Small nerves may be injured, resulting in weakness, paralysis, and loss of feeling in the hand. The tendon may be injured, resulting in weakness of the hand.
There is also the possibility that the pain is not totally relieved and the strength and motion of the hand may not go back to normal. The arthritis and pain may recur.
After the surgery, your hand will be bandaged. Your doctor will ask you to keep your hand elevated above the heart level to reduce swelling. The splint cast will remain from 3 to 6 weeks after the surgery. Your doctor may also recommend a protective splint for heavy work. When you shower, you will need to cover the dressing with a plastic bag. Your doctor will tell you how long it will take before you can go back to work. This depends on your age, type of work, your surgery, as well as other factors.
Your doctor will arrange a follow-up visit to examine the incision and remove any sutures.
Your doctor will indicate the hand rehabilitation program suitable for you. Physical therapy is very important for recovery. It may take 6 months to 1 year before you notice the full benefit of the operation.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Basal joint arthritis is a common condition. It causes pain and discomfort in the hand and affects its usage.
Avoiding repetitive motion may allow the symptoms to improve. You can rub creams containing capsaicin or other pain reducers over the joint. Oral anti-inflammatory medication may decrease the pain and the inflammation. Injection of steroids in the joint may also help.
Hand surgery can help relieve your hand pain and immobility when other non-surgical treatments fail.
The surgical procedure aims at removing the whole joint or just a section of it. The joint is then replaced with a piece of tendon. Your doctor will indicate the hand rehabilitation program suitable for you. Physical therapy is very important for recovery. It may take 6 months to 1 year before you notice the full benefit of the operation.
Surgical treatment for basal joint arthritis is very safe with excellent results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.